Hi everybody, I just want to let you know a little bit about myself. I definitely know about arthritis. I've been experiencing it for a little over 20 years. I had a massive injury. A little story about myself, I had 3 back surgeries and 3 knee surgeries. This is what's in my back. I still have 1 set in. They finally had to take 1 set out because it was giving me some problems. Titanium screws and plates. This is the titanium screws that came out of my right femur. I got a big chunk of cartilage in my knee, about that big around, is missing. So trust me, I get it. I know what pain is. I know as much as you guys do, probably more, and some of you may even know more than me. If you do, I feel sorry for you. Listen, how do we deal with these things? How does the doctor deal with it? Surgeries, and then what? Medications. What do medications do for us? Can medications solve arthritis? No, they can't. The medical industry to this day hasn't been able to solve arthritis. Now, here is just a kind of a snapshot here of what's going on with all the medications that I was on. I haven't taken any of these since June, about mid-June. So, you know, that's a pretty good mix. I'm going to show you a list of everything that I was on. I hope you guys can see this because I can't tell. But basically, this is what you take for pain and for muscle relaxing. This is what you take in the beginning. Now, I took this for almost 20 years, and what happens when you take it so long, it eats away at your stomach. Now, I woke up one morning and I started puking blood, and it went up that I had an ulcer, bleeding ulcer created from this stuff. Now, then I had to go to another doctor, and he gave me this stuff. Funny, huh? Then, basically, I got that kind of under control, but then I couldn't sleep anymore. So then I started having problems with insomnia. So I went to the doctor, and he gave me this stuff. Doctors are great, right? They got a pill for everything. And I'm not being hard on doctors, really. They do the best they can with what they have to work with. Now, I had those injuries, and so obviously I couldn't work physically. So what did I do? I went and got a desk job. Now, here's the last thing. It's funny, huh? And I want you guys to look at this. This is x-rays of my hands. This is this thumb. The cartilage is worn down. So I have massive problems here. I have problems with my wrist. I have a lot of problems in this area due to the tendons. Why? Overworked them all. Why? Check this out, a mouse. All of you guys that have worked at home or using computers, you know what I'm talking about. Now, you want to hear the funny thing is, I'm the kind of guy that just keeps on going. Not like a lot of you people are. I got myself a special mouse, you know. Hey, this one don't work, well these work, so let's just keep going. You know, I can probably get another 2 or 3 years out of that arm. Thing is, what do? So you keep taking these. I don't know, there's an end to it all. Now, I forgot something. You gotta have the pink stuff, you know. How many times do you wake up in the middle of the night with that heartburn and it's running up in your throat, you can't take it anymore? You gotta have the pink stuff. So what's the solution, guys? It's definitely not this. It's not this. I got lucky. I got turned on to this. It's called Provalin. It worked for me. How did I take it? I'm gonna tell you right now. I took a tablet in the morning, 1 at midday, 1 at night. I took it for 5 days. 3 tabs, 5 days. I got 80% reduction in pain. 80%, guys. None of this. I'm not on this. I wasn't on it. With this product right here, I got an 80% reduction in my pain. It took me about 10 days longer, and I got off the other 10%. So I'm running about 95% pain free. It's wonderful. This stuff is natural. It's not going to hurt you. You're not going to have a liver transplant, and you probably won't get that bleeding ulcer like I did. Now, we all know on anti-inflammatories they're going to get you. This won't get you. It's I think they said it was made out of some sort of fungus. You know, like penicillin? Well, hey, if a fungus works, it works. Trust me, it works. If it works for me, it's going to work for you. You owe it to yourself. Take my word for it. It works.
Mauro Palladino.
Bob Kondrowski.
And this is Nigel. He's 15 years old.
Back in the summer, Nigel began limping on his back paw. And after a week or so, it got worse. It exacerbated itself. He was actually holding it up. And after about 3 days of this, I couldn't take that he was in this pain anymore. It didn't go away. It only got worse. We phoned the doctor, and the doctor said, come up. He made a few tests, and he gave us this product called Chondropaw, and gave it to him, and the results, within 48 hours, he was our old dog again.
He was running, he was hopping, he was jumping, he was going up and down
And
the
we give it
steps.
to him once a week, every Tuesday morning, and it just keeps him active and going. It was discovered that the dog has arthritis in the back leg, and it's worked so wonderfully. It's reduced the inflammation almost to nothing, and I would highly recommend that a dog with back leg problems or arthritis use this product.
3, 2, 1, now.
This is my dog, Baby. She's over 11 years old. She's a
I'm
family
Melissa
dog. We
Marino.
all
This is
love
my
her.
dog,
All the
Mishka.
grandchildren
She's 7
love her,
years
but
old.
she's getting old and she has trouble with her
She
leg
was
back
having
here.
problems getting up,
And I was
laying
giving her
down.
medicine
She's
from
having
the
problems
vets.
getting up steps. She
It
was
was a
having
steroid,
problems
and then I was also
walking
giving her a
and
painkiller.
just
She's been
daily
doing that for 3
activity
years.
whenever
I
she had
heard
to
about
go
Chondropaw,
get
and I
up and
wanted
down.
to try it.
So
She's
we
been
put
on
her
it
on
1
Chondropaw,
month. She's not taking
and we saw
anything
results in
else,
about a week.
no painkillers.
and she started
Nothing
moving a lot
else.
better.
And she
When I
is
take her for
as
walks,
good
she's
as,
actually
if not
walking a lot
than
better.
when
She's
was
not
taking all
limping
that
so much.
medicine
She's only been
from
on the
the
product for
vets.
about a month,
This
but I
is
have seen
natural,
really good improvements.
so I don't have to
and
worry
I
about her.
keep her on it to see how much better she's going
Not
to
going to
progress.
have an upset stomach
She is
from
doing a lot
it.
better
She's
than
not going
walking
to have to check her
and
liver
going up
or
steps.
anything like that.
I would
It's
totally
perfect. I
endorse
just
this
wish I had
product. I
known
think
that a
Chondropaw is
long
great,
time
and I think
ago.
it would benefit a lot of
I
people.
have 3 other dogs, and when they start having trouble, believe me, they're also going to get Chondropaw because it's so good for them. It's all natural, and it's the perfect for Baby, my dog.
3, 2, 1, now.
This is my dog, Baby. She's over 11 years old. She's a family dog. We all love her. All the grandchildren love her, but she's getting old and she has trouble with her leg back here. And I was giving her medicine from the vets. It was a steroid, and then I was also giving her a painkiller. She's been doing that for 3 years. I heard about Chondropaw, and I wanted to try it. She's been on it 1 month. She's not taking anything else, no painkillers, nothing else. And she is as good as, if not better, than when she was taking all that medicine from the vets. This is natural, so I don't have to worry about her. She's not going to have an upset stomach from it. She's not going to have to check her liver or anything like that. It's perfect. I just wish I had known that a long time ago. I have 3 other dogs, and when they start having trouble, believe me, they're also going to get Chondropaw because it's so good for them. It's all natural, and it's the perfect for Baby, my dog.